The content of this program represents the opinions, research, and observation of the host and his assessment of scientific evidence available at this time. None of the statements, claims, techniques, dietary guidelines, or supplements mentioned in this program have been evaluated by the Food and Drug Administration. The information contained herein is for educational purposes only. It is not a substitute for standard care provided by medical practitioners. Any application of the advice presented here is at the listener's own discretion or risk. The information should not be used for self-diagnosis or application. Always consult a qualified healthcare professional before beginning any new nutritional, exercise, or lifestyle improvement program. The host and this station disclaim any responsibility for any adverse effects arising from the use or application of information contained in this program. Now broadcasting from his Nutritional Command Center deep in the heart of Victoria, Texas, charging through the swamp of misconceptions, deception, and myths, bringing to you the newest cutting-edge scientific-based nutrition information so you can enjoy whole spectrum health. Here's the paladin of nutrition and whole foods expert, Labron Allen.
Good morning. It's Saturday. I'm your host, Labron Allen, and this is Health Alert. So, health news from the New York Times, the prestigious New York Times newspaper. Headline: What really makes us fat? Well, we know for decades we've been told that it is totally dependent on the amount of calories that you're eating and then subsequently burning as to whether you will gain or lose fat. Well, by now, if you've listened to this show for any length of time, you should be aware that that is not the case. Well, that's also what Gary Tobes, who wrote this article, What Really Makes Us Fat, and the book as well. The title of Gary Tobes' book is Why We Get Fat. That is actually a very good book. I recommend that you find that and read that. However, he basically says the same thing, that calories really don't have a lot to do with weight loss as far as counting them, watching them, and trying to burn them. If you have ever been on one of those exercise machines that tracks the amount of calories that you burn while you're exercising, well, you probably became rather discouraged because you just aren't losing that much no matter how hard you're working out. You're really not losing or burning up very many calories. Now, do you know how old this calorie idea dates back to? It's well over 100 years old. It's actually 130 years old. It dates back clear to 1878, and it comes from a German nutritionist. His name was Max Rubner, and he actually established what he liked to call the isodynamic law. However, that was the beginning of the controversy of exactly what makes us fat, calories in, calories out, etc. And so that is really the beginning of the debate between carbohydrate and the other side of it is calorie. So what is becoming more and more apparent that what truly makes an individual fat, quote unquote, is not calories, but it is carbohydrates, because carbohydrates is what is actually converted into fat and stored as subcutaneous tissue. Fat. So it is not we eat calories and get fat, it's that those calories contain carbohydrates, and we eat over and above the amount that our body requires, and that above amount, over the threshold amount, is converted into a triglyceride and stored as body fat. So it's just interesting that that information is becoming more and more mainstream. Now, you know, on this show we talk quite a bit about genetically modified food. This is another report. It's from the ISIS report as of June the 12th. It says, GM soy linked to illness in farm pigs. So this was a Danish farmer, and what happened is that his pigs that he was feeding genetically modified soybeans to became very, very ill. Some of the things that these pigs were suffering included chronic diarrhea, birth defects, reproductive problems, reduced appetites, bloating, stomach ulcers, weaker and smaller piglets, so it was affecting their offspring, and also reduced litter sizes, so it was also affecting them reproductively. Now, it was getting to such an extent that this Danish farmer decided to stop feeding his 450 sows with GM soybeans, and instead he replaced them with fish meal and non-GM soybean. And it took merely 2 days, 2 days, for him to notice significant changes in their health. 2 days. Now, why is this report of particular interest to us? Well, it's because that in some studies they actually use pigs as the experimental species. The reason being is that pig physiology is very similar to human physiology. So let me ask you, do you think that eating genetically modified soy may affect you? The next report, this comes out of the Environmental Health News. Headline, Bisphenol A, exposure linked to brain tumor diagnosis. So now they are finding that exposure to bisphenol A is a risk factor for common types of brain tumors. And this comes out of a study from China. They found that those with the highest urine BPA levels were about 1.6 times more likely to be diagnosed with this common type of brain tumor than those with lower concentrations in their urine. So that is another reason to stay far away from plastics. And it's not just bisphenol A free plastics that are quote-unquote safe, because now they're talking about bisphenol S that is also in these supposedly safe plastics, including polycarbonates. Next, this is out of Reuters. Headline, U.S. group flags chemical levels in Coke sold abroad. What's happening is that Coca-Cola's Coke product, the namesake, being sold in several different countries, including Brazil and Kenya, they contain a very high level of a chemical that is directly linked to cancer in animals months after it made changes to the drinks sold in California. Says that the Center for Science in the Public Interest said that the samples of Coca-Cola tested in the 9 countries showed alarming amounts of the chemical. So that's really great. I hope that you guys do not drink soda, because the way it works is that for everything that is known, there is something that is not. So recently I was looking at a local newspaper in the lifestyle section, and noticed that there was an article from a couple of nutritionists, one being a registered dietitian, another one being a naturopath. And it's interesting just looking at the two articles, how different they are from each other as far as the recommendations that they were giving. One was touting, what we typically hear from the mainstream from your medical doctor: low fat, skim milk, eat bread, grains, etc. And the other one was talking about egg membrane and how that can be beneficial for joints. But what struck me as interesting is that though there were different recommendations for things, that what was not there was proof of their results from either of the recommendations. Now, it seems like that if someone recommends certain ways of doing things, that there should be able to be proof, evidence that what they are recommending to you is indeed effective. And so that is one reason why I tell you and give you health experiences from many of my patients. We have done interviews on this radio program. You can actually go to our Facebook page, which, just to remind you, is www.facebook.com/natural.health.clinic. And there you will actually find dozens of real-life patient testimonials of how a health improvement program and the recommendations that we make have significantly changed their lives. And so I encourage you just to read those. They are very encouraging if you have any type of health concern or not. And they just really lift your day, even if you do not have a particular health concern. As well, on our Facebook page, we also have a video from one of our patients that had quite a health odyssey that she went through for over 2 years. She, according to her own story, had spent well over $20,000 going to different medical doctors and was unable to find help. Went to different nutritionists and was unable to find help thus far from that source. And then she finally, through referrals of a couple of her friends, at least 2 of her friends, told her that she should come over to the Natural Health Clinic and check that out. And once she did that, well, you'll just have to listen to the rest of her story. And that video is on our Facebook page. So here's the thing, folks. The things that I recommend to you work. Like we were talking about last week, it is not a matter of hoping that a health improvement program benefits you. That's not even the question. The question is, will you do what it takes? That's the question. And not everyone does, because not everyone is actually a nutritional case. So last week we were talking about as well the benefits of a health improvement program, and I would like to recap that. Again, what we do at the Natural Health Clinic is use nutrition response testing, which is a form of analyzing using the body's autonomic nervous system where there is stress within the body and what nutritional deficiencies will help the body restore those areas, will turn that stress off. Now, I personally hold a master's certificate in nutrition response testing. I am one of just over 400 doctors and clinicians throughout the entire nation. I'm number 338 who actually has achieved the status of master certification in nutrition response testing. Now, using nutrition response testing, we can pinpoint exactly what a person needs to bring their health up to the next level or to the optimal level of what they would like to achieve. We use whole food nutritional supplements. We do not use anything that is fractionated, because our entire philosophy is that everything we're eating is fractionated in one way or another, because it doesn't contain everything that it needs, and our bodies become nutritionally deficient because our food is deficient. Therefore, if we were to take just fractions of certain things, like you take a B complex from, well, just about anywhere, and did you realize that that's just a fraction of the Bs? Even though it says complex, it is just a few of them. You ever notice that it's B1, 2, then they start using thiamine, then it goes folic acid, vitamin B12. The question is, well, what happened to the others? Okay. Well, there are many B vitamins, but the problem is that when you take them out of food, unless you do it absolutely correctly, it has to be in the food. It has to be from a food concentrate. Otherwise, if you try to extract these Bs from food, they perish. So therefore, the problem is that you cannot make a fractionated product with all the Bs in the entire B complex as it appears in food. You just cannot do it. You must use food as a B complex source. That's just an example. So that is why we use whole food nutritional supplements. Now, besides fractionated, we also avoid as much as possible using synthetic nutraceuticals. The reason being is that really all these are safer drugs. They're much safer than pharmaceuticals, but they are a nutraceutical. They are a synthetic lab-created molecule, and so you do run the risk of some form of side effect with long-term use. In the short term, there may be some benefit, actually quite a bit of benefit, depending on how it's being used. Now, you must realize that these synthetic supplements, that is what is plentiful at the health food stores. No matter what they say and no matter what the name of these health food stores are, what they carry, 99% of what they carry as far as supplements is synthetic and fractionated. Now, that being said, another point, an aside, is that even if you have a product that claims to be from whole food, you have to realize that unless the manufacturing process has been done correctly, which means low temperature, low moisture, in order to create that capsule or that tablet, then it doesn't matter if that supplement came from whole food or not. If the proper techniques to create it in low heat, low temperature, and low moisture were not there, then it is still garbage, because the majority of the nutrition will be lost if those requirements of low heat and low moisture were not used. And I will tell you that most manufacturers do not create their products, even from whole food, correctly. So keep that in mind. In fact, there are very few. We're talking about being able to count on a couple of fingers how many manufacturers actually create true whole food concentrated supplements. Now, we also give our patients, so we help them with their diets. It's very intelligent, it's a personalized and effective and ethical way to manage their diet. The main thing is that we get them to eat real food, not the prepackaged health foods or the latest fad, or all the processed foods that typical people eat. That's why they're sick in the first place. You see, that's the first thing that makes a good nutritional patient, is that they start realizing that what they have done thus far has greatly contributed to where they are at now with their health. If you are willing to accept that, I tell you, you are well on your way to already improving your health, because then that empowers you to do what needs to be done to actually make changes. You see, if you are not responsible for where you find yourself in your health condition, then how are you going to find help? Who is responsible? Your parents, your medical doctor, your spouse, your children, the president, Obamacare? Who's responsible? You see, if you give responsibility over to someone or something else, you will never truly attain optimal health. It's not possible. So, just recapping the benefits. The first benefit of a health improvement program is that we are able, using nutrition response testing, to recommend specific nutrition for the cause of your health concern, not the symptom. Now, we want the symptoms to improve, yes, but don't you really want to get to the root cause? You know, let's take skin. Let's say that you're having dry skin. Well, the root cause might be that you're just deficient in omega-3. That could definitely be a root cause. But there could also be a thyroid issue that is creating that, right? There could be some kind of hormonal imbalance that is creating that situation. Now, it goes even deeper than that. Let's say that it is a thyroid condition that is contributing to the dry skin. Well, what's creating the issue with the thyroid? You see, the thyroid is still just the symptom, as is the skin. And so with nutrition response testing, we are able to get deeper into that. Is there some form of stress within that thyroid? Well, what might be stressors? It could be a food allergy. It could be an infection of some kind. It could be a heavy metal toxicity. It could be chemical toxicity. It could be scars. It could be some form of specific emotional stress that is keeping the thyroid gland from functioning in the way that it should. And nutrition response testing allows us to identify, if there is a stressor, what it is and what the body needs in order to remove it. The next benefit is that a health improvement program costs less. An office visit costs less than your health insurance premiums. And you actually feel better. I mean, can you go to your medical doctor for whatever health concern you may have, get the properly prescribed medication, take it, and actually say that overall you feel better in your health and that you have a better sense of well-being, vitality, able to handle life in a more relaxed and effective manner? It's unlikely. One of the things about a health improvement program that I really appreciate is that you truly are able to get younger. Now, is there anything else that you have ever heard that you can do that enables you to become younger as you age? Physiologically younger. Now, exercise to some degree can help with that, but there are not very many things. I mean, you hear about this anti-aging and longevity things, but basically they're just going to give you a bunch of hormones that in the short term will probably make you feel better, but in the long term, they are going to create issues. Be aware of that as well. So there isn't much that can offer to you that you can actually become physiologically younger. I mean, I have many patients who are in their 70s, incredibly active, and they look better than they did before a program. It is incredible. Now, the interesting thing is that you start a health improvement program and incurable conditions just simply go away. We've had success with blood pressure problems, reversing diabetes, chronic pain, fatigue, sleep problems, skin rashes, arthritis, gout, bursitis. You name it, we have probably worked with it, and we have been successful with it. We look for and find parasites. Yeah, I know, in this country it's not admitted that there are parasites. It's only in the third world countries, right, that you could have a parasite. Well, you know what? There's many forms of parasites. Some of them are incredibly small, and they can be anywhere within the body, including the brain. They can be in your bone. They can be in the pancreas. They can be in your thyroid. And yes, you can have larger worms crawling around in your intestinal tract as well. Now, it used to be many years ago, even in this country, it was normal practice in ranches and farms to worm, quote unquote, worm your animals and then also worm your children. I mean, every few months, couple of months, that's just what was done. And then all of a sudden, that wasn't necessary anymore. Of course, you always hear about Giardia in water. Do you realize Giardia is a parasite? So there indeed are parasites all over the place. And parasites are probably the most untreated type of infection within this country. I would say that 90% of us, at least, have some form of parasitic infestation. Now, we also, like I mentioned before, have a very special program that if you follow it, the average is 47-point decline in your cholesterol within just 3 weeks. You follow this program within 3 weeks, the average is 47-point decline in your cholesterol. Now, the great thing is that using whole food supplementation, there are no precautions, there's no interactions, there's no side effects, contraindications. I don't have to do fast lawyer talk. There's no disclaimers, there's no small print. And there are no warnings when you use the whole food supplements and nutrition. We even have a colon cleanse that is short, it's easy, it's inexpensive, it's not painful, and what comes out of your intestines will absolutely amaze you. And do you realize that many diseases and future conditions reside in that colon? Think about what you could possibly prevent. We also look for iodine deficiency. Did you know that iodine deficiency, probably at least 96% of all Americans are iodine deficient? Do you know there's two places in the body where there are the highest amounts of iodine, the highest concentrations of iodine, that being the thyroid first and second, breast tissue within females? There's a lot of talk about possible breast cancers being due to a deficiency of iodine in breast tissue. And you know what? The good thing about being on a health improvement program and being able to use nutrition response testing is that there is always something that we can work on that will get your health to the next level. You see, we are always looking for improving that health, improving that health. We just want you little by little, day by day, improve that health, ever improving. Can you imagine what you have the potential of achieving? So, I talked about there are some persons who are not nutritional cases. So then the question is, well, who are the best cases for a health improvement program? Who are the best patients for a health improvement program? Well, you know what? That is a good question. Now, our best patients, here's what they have. They have a body that's in need of some repair, and they especially have a strong desire to improve their health. Of course, they have to have transportation that is reliable so that they can come to the office and that they have the time to make all their scheduled appointments as needed. They need to have the ability to purchase the proper food and the schedule to prepare that food. Our best patients will have family members and friends that are actually supportive of the choices they're making. They are happy to see that you are working towards improving your health, and oftentimes, once they see the results you're achieving, they will want to join in as well. You do not want to have family members that are critical or questioning. This will keep you from improving. It will be discouraging, and it will not help you to attain your health goals. Our best patients have the understanding that drugs and surgery, they are a last resort. They are not the go-to method. Why on earth would you want to do things that are so invasive when there are so many options that are incredibly effective? So our best patients have the understanding that drugs and surgery are a last resort. And whole food and whole food supplements are the answer to most chronic health concerns. Now, our best patients also arrive on time for their scheduled appointments, and they always have a diet record that is complete, because that is one of the best ways that we can help them with their diets and achieve optimal health. Again, they keep all scheduled appointments so that we can continue to keep improving their health and to fine-tune anything that might otherwise keep them from gracefully attaining the next level of health. Now, of course, if they can't keep their appointments, they're going to reschedule them immediately so that they don't get off track. What it means is that our best patients make these health improvement program visits a priority. They follow instructions on how to take their supplements, and they take them every day exactly as we have it outlined. They do what is necessary to get adequate rest and some form of physical activity, even if it's just walking around the block a few times a week. And most importantly, they're going to be following dietary recommendations absolutely as closely as possible, and they work at making little changes each week so that they just steadily improve their diet. They don't make gigantic overnight changes. That's not going to be successful, and that's not what we expect, and that's not what we recommend. Little changes, little improvements, every week add up to gigantic changes within even a short time. Now, here's an important thing. Our best patients, if things are improving, they just continue to do what they're doing. We strengthen the things that are working, and if something isn't working, then we change it so that they continue to get improvement. But the important thing is that if something's working, you do not change it. And believe me, that's sometimes harder said than done, because for whatever reason, we tend to want to, human nature seems to be, to fix something that's not broken. Now, as far as diet, what our best patients do is they eat protein, they eat the proper forms of fat, which include animal fats and veggies, at least twice a day. They avoid sugar and refined carbohydrates. They completely avoid soy, especially that genetically modified we just talked about. They limit carbohydrate servings to 10 per week, and of course they drink plenty of water. And if there are any foods that they're allergic to, that tested they're allergic or sensitive to, they obviously are going to stay away from there. Now also, our best patients are able to communicate clearly their symptoms, their problems, and their health goals. That's how we're able to create a plan to achieve what they're looking for. If it's not very clear, if there's not a definite objective, well then, what's the goal? If they have any issues, they have any questions, they call the office immediately. And when a health issue and a concern comes up, you know what? They're going to call us first instead of someone else who is not knowledgeable about nutritional healing. They avoid popular media sources for their health information because that stuff is just a bunch of baloney and garbage anyway. And they also make sure that they get tested by us for heavy metals, parasites, vitamin D deficiency, artery support, iodine deficiency, so that we can deal with any of these as they are necessary. Of course, they would take any lab tests that we recommend, and they are going to follow the treatment schedule and keep appointments so that all their organs can be checked and repaired as needed. So those are some of the things that make a good nutritional candidate. Are you one of those people? Well, if you are, then what you need to do is come to our next free health seminar, which is July the 10th, and you can learn about exactly what a health improvement program is, what's required of you on that program, and how you can attain your health goals. If you would like to do that, all you have to do is simply call up Tanya at our front desk. The number to the office is area code 361-575-4683. As well, you can contact us at radio comments at vitaminmyths.com or radio comments at healthimprovementprograms.com. Well, that's it for this week. Until next, this is Labrin Allen, and you're listening to Health Alert.